This is hydrochlorothiazide, globally used by millions of patients for treatment of hypertension. It has been previously shown to provoke sunburns and has been linked to an increased risk of lip cancer. This prompted a group of Danish scientists to ask the question, is hydrochlorothiazide also linked to skin cancer? They used the nationwide Danish health registries, which contained detailed data on cancer diagnoses and use of prescription drugs for the entire Danish population of more than 5 million residents. Using these data, the researchers could investigate with great precision if users of hydrochlorothiazide are diagnosed more frequently with skin cancer. They did it like this. First, they identified 80,000 patients with a diagnosis of so-called non-melanoma skin cancer, and a group of 1.5 million persons without skin cancer. Then, they mapped out how much hydrochlorothiazide had been filled at the pharmacy among the persons without skin cancer, and how much of the drug had been filled among persons in the skin cancer group. And the result was clear. The more hydrochlorothiazide a person had used, the higher the risk of skin cancer. The risk of the most common skin cancer, basal cell carcinoma, was increased by a modest 30% among long-term users. However, the less common but more serious squamous cell carcinoma showed a much stronger association with hydrochlorothiazide use, with long-term users having a 4-fold increase, rising to a more than 7-fold increase among those with the longest use of the drug. In fact, the scientists estimated that if they took away the effect of hydrochlorothiazide, 1 out of 10 of all squamous cell carcinomas occurring in Denmark would have been prevented. What does this all mean? These newly identified associations between hydrochlorothiazide and skin cancer needs to be weighed against the known benefits of using the drug. As there are many other antihypertensives available with no association to skin cancer, the use of hydrochlorothiazide could be reconsidered. This could hopefully lead to a safer antihypertensive treatment in the future. However, an increased risk of skin cancer does not generally impose serious health consequences, and it is important that you do not discontinue or change your antihypertensive medication due to the new findings without consulting your physician. The study is published in the Journal of the American Academy of Dermatology and was conducted by researchers from Denmark with funding from their universities, the Danish Independent Research Council, and the Danish Cancer Society.